Obesity, a chronic progressive disease, is anticipated to affect 1 billion people globally by 2030. It increases the risk of many other conditions, contributing significantly to morbidity and mortality worldwide. Current guidelines for treating obesity recommend the addition of an anti-obesity medication or, in some cases, metabolic surgery when lifestyle intervention alone is inadequate. However, there is need for more therapies that can provide substantial and sustained weight reduction and yield more clinically meaningful benefits for people with obesity. Tirzepatide, a novel glucose-dependent insulinotropic polypeptide (GIP) and glucagon-like peptide-1 (GLP-1) receptor agonist, has shown promise here, with previous studies reporting greater weight reduction with tirzepatide compared to selective GLP-1 receptor agonists in people with type 2 diabetes. Taking this forward, scientists designed several clinical trials, known as the SURMOUNT Clinical Development Program, to evaluate tirzepatide for chronic weight management. The program will determine the safety and efficacy of tirzepatide 5, 10, or 15 milligrams compared to placebo administered subcutaneously once weekly. All trials will include a lifestyle intervention for weight reduction. The SURMOUNT 1 and 2 trials will investigate fixed doses of tirzepatide, while SURMOUNT 3 and 4 will evaluate the maximum tolerated doses. A 20-week dose escalation period is included in all the trials, with a starting dose of 2.5 milligrams once weekly, increased by 2.5 milligrams every 4 weeks up to the assigned dose. SURMOUNT 1 and 2 are 72-week trials, except for those participants with prediabetes at baseline in SURMOUNT 1, who will continue for an additional 2 years. In SURMOUNT 3, participants are enrolled into a 12-week lead-in intensive lifestyle modification program, and those achieving at least 5% weight reduction are randomized to 72 weeks of treatment. In SURMOUNT 4, the lead-in period is characterized by 36 weeks of open-label tirzepatide treatment, which is followed by 52 weeks of double-blind treatment. 5,066 participants are enrolled across the 4 global trials. These include adults with BMI more than or equal to 30 or more than or equal to 27 kilograms per meter squared with a weight-related complication. SURMOUNT 2 also required participants have an established diagnosis of type 2 diabetes. Across the 4 trials, participants have a mean age of 44.9 to 54.2 years and a mean BMI of 36.1 to 38.9 kilograms per meter squared. 50.7% to 69.7% are female. The results of the primary study period of SURMOUNT 1 were recently published, while those of the other SURMOUNT trials are expected to be released in 2023. Further investigations on the effect of tirzepatide on obesity-related complications are also underway. The SURMOUNT trials will provide relevant evidence for the use of tirzepatide in weight reduction and maintenance, thereby providing a much-needed breakthrough in chronic weight management for adults living with obesity.